Imagine what life would be like if you could never speak properly, never go to school, never smile. Nobody actually knows just how many children there are in the world who are struggling through life with cleft lips and cleft palates. Some experts say the number is as high as 10 million, and it grows every day. This year alone, more than 100,000 children will be born with clefts, and few will ever receive the reconstructive surgery they so desperately need. Being born with a cleft in a developing country is really a life sentence of shame and isolation. Most of these children will never be able to speak or eat properly. They're not allowed to attend school or hold a job. Most will never marry or raise a family. The greatest tragedy is that virtually every child in the world who is suffering with a cleft today.
What are the causes of oral cleftings? They don't know exactly why a baby develops cleft lip or palate, but they believe that it may be a combination of genetic and environmental factors, such as certain drugs, illness, and the use of alcohol or tobacco while the woman is pregnant. The risk may be higher for kids whose sibling or parents have a cleft or who have a history of clefting in their families. When we have a look on the normal development, we find that the nasal septum is developing vertically, and the two palatine shelves are developing horizontally, meeting together and fused. Complete fusion results in a normal development and a normal patient. The upper lip is derived from medial, nasal, and maxillary processes. Failure of merging between the medial, nasal, and maxillary processes at the 5th week of embryonic development on one or both sides results in cleft lip. Cleft lip usually occurs at the junction between the central and lateral parts of the upper lip on either side. The cleft may affect only the upper lip, or it may extend more deeply into the maxilla and the primary palate. Cleft of the primary palate includes cleft lip and cleft of the alveolus. If the fusion of the palatal shelves is impaired also, cleft lip is accompanied by cleft palate, forming cleft lip and palate abnormalities. Cleft lip can easily be diagnosed by performing ultrasound in the 2nd trimester of pregnancy, when the position of the fetal face is located correctly. Usually it is not possible to diagnose a cleft palate by an ultrasound. However, an experienced physician or technician may catch an atypical movement of the fetal tongue in a lateral view. In the case of a large cleft palate, the tongue moves up into an open space, which is the cleft in the roof of the oral cavity. Recently, the 3-dimensional imaging, which you are seeing now, has been introduced to prenatal ultrasound diagnostic of cleft anomalies and seems to be very promising for recognizing a cleft palate in a fetus. The secondary palate develops from the right and the left palatal processes. Fusion of palatal shelves begin at the 8th week of the fetal period and continues usually until the 12th week. One hypothesis that a threshold exists beyond which delayed movement of the palatal shelves does not allow closure to take place, and this results